Earlier this year, the Food and Drug Administration issued a warning about a rare and deadly cancer linked to breast implants. The agency says at least 457 women in the U.S. have been diagnosed with anaplastic large cell lymphoma. 9 of them have died. The FDA also sent a letter to healthcare providers to help them diagnose that disease early. Dr. Elise Romay and Dr. Marianne Piskin are here with us this afternoon with more information on the topic. Okay, so now both of you ladies are board-certified plastic surgeons. You came to me with this information because you are seeing sort of an influx in questions and concern in both of your practices, right?
Yes.
People are nervous. They heard this news, and then they immediately the knee-jerk reaction is, I want to remove my implants immediately. So talk more about sort of why y'all wanted to come to me and talk to us about this.
Okay, we wanted to talk to you and the public because there are 2 illnesses out there. ALCL, which Dr. Rowe will talk about in a minute, and breast implant-related illness. And breast implant-related illness first was kind of talked about in the 90s when the FDA removed breast implants from the market. A lot of women were feeling like they were ill from them, and they came to get them out. And then it went away after that group of women over the 3 or 4 years in the 90s were treated. And now it's back again. Talk about it. It was studied before the FDA put implants back in on the market in 2006. But there's just a resurgence of people who are feeling that they have illnesses like lupus, chronic fatigue syndrome. They just don't feel good. They have facial swelling, lots of different symptoms. Plastic surgeons don't know if this is a real illness. And we really would like to know the answer. When you go back and look at the studies that have been done, they're quite incomplete. And that's because, like we see in our practices, the women stop coming to give their results to the studies. So we see that in our practice. It usually means the patients are doing well. But as a result of them not coming back, we don't have great follow-up. So if we see patients now complaining about these symptoms, we're happy to help them get their implants out. We don't know if there's a real illness, but we're going to treat it like it is a real illness. So nobody should feel bad about asking any one of the 3 of us that.
Okay. And then so let's talk about this more specific, this cancer that has been sort of linked to breast implants, but a specific type of implant, right?
Yes. So ALCL, or the anaplastic large cell lymphoma, it's a type of cancer that will develop around textured breast implants only.
Okay.
There have been worldwide roughly 650 cases documented since breast implants have come about since the 60s. There have been no documented cases in the smooth implants.
Okay. So we actually have a couple of implants, and we're going to show those to you in a little bit. And you can very much tell the difference between a textured and a smooth. And
yes.
What are they? Do they know why they're more susceptible in the textured implants?
There are a couple of theories. It basically has to do with the texturing itself and the reaction. There are current studies going on as well, whether or not there's a genetic component, whether some women are genetically predisposed. Those studies are still in process. So there are ongoing studies looking at those. The way that it is diagnosed is on a biopsy alone. Okay. So the only way that we know is if we biopsy the capsule or the scar tissue around the implant, or the fluid that can develop around the implant itself. It typically does not present, the cancer itself does not present for roughly 8 to 10 years after the implant has been placed. So it's not an immediate development. Typically a female will present with a fluid collection around the implant, or a lump that develops around the implant itself is how it will present.
Okay, and so treatment for that is different than the treatment would be for illness, right?
Correct. The treatment for the breast implant-related illness is just removal of the implant itself. Treatment for the cancer, or the ALCL, is removal of the implant as well as the scar tissue or the capsule that surrounds the implant. Complete removal.
So that's a far more extensive surgery,
Correct.
right?
Yes.
Okay, so in closing, if people are watching, if women are watching and they are nervous, would you say you have a need to be nervous? Do you just need to have a conversation with your surgeon, with your doctors, just staying on top of noticing any changes? What can we do to sort of put people's minds at ease or raise their concern if need be?
All of us and all of the board-certified plastic surgeons in the Panhandle are more than happy to meet with anyone who has any concerns relative to their breast implants. We would really want anyone to contact any of our offices. Feel free to come in, let us look at their breast implants. You know, we'll address any of their concerns. If they would like them out at all or just to talk about their concerns, we'd be more than happy to do that.
And we want people to have follow-up. I don't even charge for follow-up on my breast implant patients, ever.
Yeah.
Lifelong. As long as I'm around, I'll follow them at no charge. So they should come back. That way we'll get
really stay on top of your medical.
That way we can look and see if there's anything unusual. We can talk about treating it. We can make sure that nothing's going on that shouldn't be.
Well, very good. Ladies, thanks so much for coming by. I think this is an important topic. I'm glad we talked about it today. So really, really important. Thanks, guys.
Thanks for having
us. All right, stick around. We're going to switch gears pretty significantly now. The Amarillo Zoo wants your kids to spend the summer with the